Trailmixing, but what it's really about, it's about the prescription drug epidemic which on Staten Island is a major issue compared to other New York City boroughs. We have the highest rate of accidental overdoses from misuse of prescription drugs. We're very fortunate today to have out with us the Chief Medication Safety Officer of the North Shore-LIJ Health System, Ms. Leigh Briscoe-Dwyer. This is, I believe, her first time out on Staten Island, so we're very fortunate to have her out here today.
Could be my last.
We're also joined by several faculty members from our department, from our SIUH Department of Psychiatry. We have Dr. Carlson and Dr. Cummings here. And so today we're going to learn about what these things mean and what they mean. This is the language our kids are talking. This is the language we have to understand, so we're able to, we're able as a community to respond to this major epidemic here on Staten Island. So without further ado, I'd like to bring up Dr. Leigh Briscoe-Dwyer.
Thank you. Well, having finally arrived in Staten Island is actually a pleasure to be here. Somehow I wound up at the complete other end of the island as from where I was supposed to be. So getting home should prove interesting. But I thank Bob for inviting me to talk about this. This is a topic that, as a pharmacist, is near and dear to my heart. As a member of the New York State Board of Pharmacy, it's something that we actually look at. We're in discussions with the Department of Health currently to talk about how we as pharmacists as a profession can actually work with one another and work with other members of the healthcare profession to try to keep better track of where the prescriptions that we're writing are actually going and how they're being used. So if we talk about farming, and I used to kind of joke with my parents that I grew up in a farming community and then I became a pharmacist, and we actually just spell it a little bit differently. But it's a trend that our teens are seeing, where they have these farming parties where the price of admission, if you will, to the party is some kind of prescription medication that they have taken from a family member or friend's prescription cabinet. They actually bring them all together and they put them in a bowl, and they look all pretty. Hence the term of trail mixing, because it kind of looks like trail mix at the end. And they mix them all up in a bowl. And the goal of the party apparently is to take handfuls of this mixture and wash it down with Red Bull and vodka, NyQuil, other forms of alcohol-containing substances. And then I guess the fun starts when they get to sit around and watch and see what happens. This one really does escape me. I realize I'm dating myself, but this particular behavior actually does escape me. The drinking age was 18 when I was growing up, and we used to have something called the hairy buffalo. I don't know if that was a completely upstate term or not, but we did the same thing with alcohol. Everybody brought a bottle of alcohol, and you mixed it with high C because I'm sure it tasted vile. And that was our thing. But this is scary because you can imagine the unpredictability of this type of behavior is concerning. When we talk about the number of ED visits that we're seeing because of unintentional poisonings or unintentional overdoses, we can see that from 2004 to 2008, the number of ED visits pertaining to specifically 3 types of narcotics pretty much doubled. And we can see specifically oxycodone visits went up by 150%, hydrocodone went up by 123%, and methadone went up by 73%. Now, some of this is in reflection to the increase in obviously writing for valid prescriptions for these medications, and that is an overflow, if you will, of the fact that we in healthcare have paid a great deal of attention in the last decade to the appropriate treatment of pain. And we all, for those of us that are in healthcare, we weren't doing a very good job of treating pain for a number of years, and we actually have raised it to the elevation of we call it the 5th vital sign, so that when we have patients who we're treating, whether they're in the hospital or whether they're in our office, we ask them about their blood. We take their blood pressure, we take their pulse, we look at their respirations, and we take their temperature. And then the last thing that we always do is we ask them about their pain. And we've developed pain scales, and we have a number of ways of measuring pain because we really didn't think that we were doing a very good job of, in fact, treating pain, and we were not. And so now I think in some ways maybe perhaps the pendulum has swung to the other side because now we're doing a very good job of at least writing prescriptions for pain medications. Whether or not we're still treating pain, that probably hasn't been measured. But that is one of the reasons why we're seeing an increase in the amount of medications that are available, the oxycodone-containing preparations and methadone. This is most likely not methadone that's coming from methadone maintenance programs. It's methadone that we're using to treat pain because it is in fact a very good drug to treat chronic pain with. So we've, you know your mainstream when you're hitting the front pages of Time, and there have also been a number of articles published in the New York Times, which I also call the New York Times Journal of Medicine, and the Wall Street Journal. So this is definitely a mainstream concept. But it's a matter of addiction in general and addictive medicine and treatment of the various addictions that we see. When we actually look at the survey that was conducted, it was actually published in 2009, a survey from 2008 that actually looked at illicit drug use. And we see that across the country, almost 22 million adults, and I believe they actually qualify this as, they did adults and included anybody who is the age of 12 or above. Almost 22 million Americans have used any illicit drug. The most popular illicit drug remains marijuana at almost 17 million. But then number 2 is psychotherapeutic drugs. So these are drugs that are narcotics, drugs that we use to treat attention deficit hyperactivity disorder, drugs that we use to treat pain. So we actually see more illicit use of psychotherapeutic drugs than we do of cocaine, methamphetamine, and heroin combined. And so that trend has continued from 2009 upwards until present day. So if we look at some of the results from that particular survey, 7 million Americans who are current non-medical users of prescription drugs, so they're the ones who are using it only for, I'll say, recreational use, for lack of a better term. Non-medical use of pain relievers is up 20% in those aged 12 and older. So, a significant increase. The number of people who have died from an overdose of prescription drugs, now whether it's an intentional overdose or an accidental overdose, they actually group those together, but it's more than 6 times the number of people who have died from overdoses of other illegal drugs combined. So we're not just using these drugs in high numbers, but we're actually seeing overdoses, both intentional and accidental, as you would probably expect. This is from a daily briefing. I'm on a healthcare blog called the Advisory Board, and they send us healthcare related information every single day. This literally hit my desk at about 12:30 this afternoon, and I thought it was important enough that I wanted to include it. That for the first time in 30 years, deaths related to prescription drug use outnumber traffic fatalities. And this was, again, I haven't really, in all fairness, I have not done my due diligence to actually investigate the study, but they actually said partly because of an increase in narcotic overdoses, but also, when actually we're able to break down that information, drug fatalities among teens and adults doubled between the year 2000 and 2008, and I apologize for the typo there. Drug fatalities for the age of 50 to 69 tripled. And when we actually, if I try to tease out some of the rationale behind that, that's probably the age group where we see a high number of prescription drugs being written for them for valid reasons. So if you look at people who have hypertension and high cholesterol and throw in some diabetes, perhaps some depression, you're looking at people who have an average of anywhere between 8 and 12 prescription medications that they're on chronically for valid conditions. And if those are not taken correctly, if those are, you throw in a couple of hospitalizations and new medications being added and other medications not being taken away, if you don't actually do a good reconciliation of your medication use, you can actually see significant problems related to that. Almost 35,000 people died in 2009 from drug-related causes alone. And if we actually start to track the number of deaths, the number of hospital admissions and ER visits that we see secondary to prescription drug use, we actually see that it coincides very nicely with an increase in the prescriptions that are written for things like Vicodin and OxyContin. And over the course of the last 3 years, we've seen the number of prescriptions written for those drugs increase by 3-fold.